Hi, Mahtab.
Hi.
How are you today?
I'm going okay. How are you?
Good, good. So I saw in your notes that you're here because of some vertigo issues.
Yes.
Could you talk to me about that?
So usually when I wake up, I feel really, really dizzy. And if I sit for like longer period of time and when I get up to, walk around, I experience the same thing, the same kind of dizziness.
Okay. So dizziness, especially in the morning?
Yes.
Okay. Sorry to hear that. And how long has this been going on?
About a week.
Okay. Any other symptoms along with that? Any numbness or tingling?
A little bit of numbness.
Okay.
And headaches too sometimes.
Okay, headaches. And what area of the body is numb?
It's usually like the back side as well as the right side sometimes too.
Okay.
But it starts from the back side.
Okay. Do you have difficulty determining temperature, like when you're in the shower, like how hot the water is?
I think it happened once or twice.
Okay. And do the headaches come and go, or do they happen at a certain time of day?
It's kind of like, it comes and goes.
Intermittent.
So, yeah.
Okay. And last time we did a head-to-toe exam, it's been about 1.5 years. You were in perfect condition. So I'd like to do something similar today. Of course, we're going to focus on your symptoms and really look at your head, do a very in-depth cranial nerve exam. But I'm also going to be just going head to toe, just so we can get on record that you're healthy in other areas, okay? All right. Any allergies to medications?
No.
Okay. Okay. And so I think I'm just going to start by doing just a couple vision tests right now. Then we'll have you get on the bed. Okay. So I'm just going to check your vitals right here. Okay. I'm going to listen to your heart and your lungs first. Okay. Okay, heartbeat sounds normal. Perfect. I'm going to listen on the bell side for murmurs. Excellent. Okay, take a deep breath in for me and release. Good. And again, deep breath in and release. Okay. I think your sleeves are thin enough that we can go ahead and use the blood pressure cuff without a problem. So, okay. All right, that's perfect. Okay. Okay, 108/80, so that's a really good sign. Okay, let's slide this off. Okay. 97.5. Excellent. Okay, now we're going to get your oxygenation, so make sure your legs are uncrossed. Can I just have your index finger? Okay. Okay, your heart rate is 80 beats per minute, which is perfect. Oxygenation is 97 at room air. Okay, I'm going to go ahead and write down your vitals. Okay, really good. So I'm going to start just by palpating your face. I just want to feel for any lumps or bumps, anything that might stick out as being concussed or just swollen. So feel your lymph nodes. Preauricular lymph nodes are non-palpable, and so are your postauriculars. Okay, I'm going to feel your neck lymph nodes. Perfect. No swelling. No swelling of the face. I'm just going to feel right underneath your skull and your cervical spine for any indentations or protrusions. Okay. Okay, I'm going to be doing just some facial myotomes. I want to test your facial muscles' ability to react. So if you could lower your eyebrows like you're mad. Okay, now try to raise them for me. Good. Now raise them as high as you can. Now try to lower them for me. Very good. Next, I'm going to take my hand on the bridge of your nose, push against me. 3, 2, 1. Beautiful. Other side. 3, 2, 1. Good. Now we're going to do your whole face. 3, 2, 1. Good. And 3, 2, 1. Excellent. Okay. Now try to look up at the ceiling for me. Good. Now try to touch your chin to your chest. Okay, very good. Smile for me. Show me all your teeth. Okay, good frown. Okay. Any pain in doing that?
Just when I was trying to look up, I feel like a little bit of pain, but
Sure.
that was the only thing.
Where did the pain stem from?
I feel like it just started from like the chin.
Okay.
And it went kind of like upward, but for maybe like 2 seconds.
Sure, okay. Okay. All right, I'm going to be doing some percussions, okay? So just tapping. Just make sure there's no swelling. Okay. All right. Just gonna be taking a look at your skin. Go ahead, close your eyes. Okay. Skin is well perfused. I don't see any jaundice, redness, no rosacea. Okay. Your skin looks like it has a perfect moisture level as well, which is a really good sign of overall health. Okay. Okay, I'm just going to measure the symmetricality of your face to make sure that we're good to go in terms of swelling and ruling out that as an issue. Okay. 6 inches here. And the other side is 6. Okay. That's 5 inches. Perfect. Okay. And then to the sides. 7.5. Sorry. That is 6.5. That's within the normal range. I'd say it's perfectly symmetric. Okay. Alright, I want to give you a few scents to smell. Just want to test your cranial nerves. And some of these are a little bit specific, so you don't have to get them all right. But as long as you're in the neighborhood of what the scent is. So this first one should be pretty calming. Go ahead and inhale. I think eucalyptus. Very close as lavender, but that's about the same. Okay. Okay, and this next one.
Kind of like vanilla.
It's sandalwood, so that one was a little off. Okay. And this next one.
Oranges?
Yes, orange. Okay. And next one.
Like sage?
Very close, rosemary. So that's very good. And this last one should be pretty easy.
Mint?
Yes, peppermint. So you got 4 of the 5 correct. I'm not too worried about that. Okay. Okay. Next we're going to do a taste test. So I have a couple slips of paper and they're going to smell like, taste like something. And these aren't going to be as specific as the smells. It's going to be like sour, bitter, or nothing. So go ahead and close your eyes. Open, close, open. What does that taste like to you?
It's nothing.
Good. That was the control paper. Okay, and the next one. Go ahead, open, close, open. What did that taste like?
Kind of sour.
Okay, yes, that was sour. So your smell and your taste are intact. I'm pretty happy with that. Next, I'm going to take a look at your eyes and your ears.
Okay.
Okay, go ahead and look straight ahead for me. Very good. Your pupils are round and reactive. No scarring, no yellowness, no abnormal constriction. Moisture level looks really good. I'm going to look at the other side. Okay. Same thing here. I'm not seeing any issues with the eyes. Very good focus. Normal constriction of the pupil. Normal coloring. No signs of infection. No abnormalities. Okay. All right. I want you to go ahead and grasp the Snellen chart and hold it at arm's length. Can you do that for me? Okay. Go ahead and read this bottom row for me if you can.
L, T, F, P, H.
Very good. And what about this row beginning with the E, ending with the O?
E, P, T, Z, O.
Good. And can you read that backwards?
O, C, T, P, E.
Excellent. Go ahead and read this row for me, starting with the O.
O, L, C, F.
Good. And then this row.
L, T,
And what's that big letter there?
E.
Good. What color is this?
Red,
What color is this?
green,
Good. And is the 8 larger or smaller than the 2?
larger,
Okay. Is the 6 larger or smaller than the 7?
smaller.
Good. Okay. Let me know when my fingers enter your field of vision.
Now,
Good.
now,
Good.
now,
Good.
now, now.
Very good. All right. And then which finger are closer to you? The fingers on your left or your right?
Right, right, left, right, both,
Okay.
left, right, left.
Okay. Little bit of inaccuracy there. You're going to go ahead and look at this stick of colors. What color is this right here?
Blue,
And here?
gray,
What about this one?
purple,
Hmm?
dark green,
Yes.
yellow,
Ish, yes.
like pink,
Okay.
then and red.
Go ahead. Just a couple of consistencies of blues and purples. Okay. So I'm going to do a hearing test next. Or looking at your ears. Okay, go ahead and look straight ahead. Okay. Your tympanic membrane is pearl gray. No excess wax, no signs of infection or scarring. Very good. No issues here. I'm going to look at the other ear. Very healthy ear canal. Normal visualization of the tympanic membrane. I would clean your ears today, but you've done such a good job yourself of cleaning them. I don't see many issues here. Let me look at the outer auricle. No irritation. Very healthy. We're just going to do a few basic hearing tests. So close your eyes. You're going to feel my gloves rustling on either your right or your left ear. Say left or right depending on which one you feel.
Left, right, both, left, right, right.
Very good. Okay. I'm going to do a couple exercises with tuning forks. Yeah, that's right. I'm going to give you two options, option A and option B. Let me know which sound is closer. Go ahead and close your eyes. A, B, B, good. A, B, B, good. A, or B, B, good. Okay. This is a vibrational tuning fork, and I'm going to be placing it in different areas of your face, and then I'll be stopping it. Let me know when the vibration stops for you, okay? Okay. Okay. Very good. Okay. Just one more hearing test. Go ahead and close your eyes. I'm going to be whispering some things in your ear. Repeat exactly what you hear after me. Thanksgiving. Thanksgiving. Christmas. Christmas. Halloween. Halloween. Valentine's. Valentine's. Puppies. Puppies. Plant. Plant. Seashell. Seashell. Tissue. Tissue. All right, very good. So I'm pretty pleased with that. I'm going to have you lay down on the bed so I can look at your scalp a little bit more, okay? Okay. Alright, Mahtab, I'm going to start just by brushing out your hair. Alright. If you could lift your head gently. Thank you. Just going to be taking a look at the part. Doing a lice check. I'm going to take a look here. Just a little bit of flaking, and I'm just seeing some red patches. So I'm just wondering about that being the source of irritation, especially the tingling. Okay, so I'm going to take a few samples. Okay. Okay, so I'm just going to be taking some samples from the part. Sample 1, below the left corner. Okay. Sample 1. Setting this aside. Okay, next we're going to find another area. piece here. Okay. I'll just write in this section. I'm going to move closer to the ear. Okay, not so much redness here, but you have a cherry angioma, a little bit of flaking. Just gonna make sure I get that. Perfect. Okay. And one more section. I'm going to do right in the center here. Okay. Just move it there. Not very much redness at the very top, so that's good. Perfect. And I'm just going to apply some saline solution to the sample bottles. Okay. Perfect. Okay. Okay, so okay. And the last one, which was in the center of the scalp. Perfect. All right, Excellent. So I'm going to put those aside. I'm going to add just a little bit of moisture to the areas of redness that I saw. This is hyaluronic acid, very friendly to the hair. Okay, just going to brush that through. Okay. We're going to do a warm or cold test. This will be a cold sensation. This will be warm. Do you feel the difference?
Yes.
Okay, go ahead and say cold or warm.
Cold. Warm. Warm. Cold. Cold. Warm. Warm.
Okay, just going to do it in the just going to do it in the midsection here.
Okay.
Okay. Go ahead and say warm or cold.
Warm. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Warm. Warm.
Very good. Okay, I'm pretty pleased with that. So I'm going to go ahead and move on to your abdomen. Sorry.
Okay.
All right, Mahtab. So with your permission, I'm just going to lift your shirt a little bit so I can listen to your stomach. Okay. All right. Sounds are normal. No excess acidity buildup. I don't hear any irritation that would be consistent with gastritis. Have you been having any digestion issues?
In some days I feel like,
Okay.
depending on if I'm hydrated or not, especially.
Sure. Is it like a burning sensation?
Oftentimes, yes.
Okay. Excuse my reach here. I'm just going to get these out of the way. So that could be some mild gastritis that you have, especially if it comes and goes. If it gets to be really bad, I always recommend going on a bland diet for a week to see if that changes it. Just rice, eggs, bread, just nothing too spicy or too greasy. I know that can be hard, especially this time of year, but if it gets to be too much of a problem, I can also prescribe some antacids to you as well if you're interested in that. Okay. I'm going to be doing some percussions. I think we're done with the percussions. I'm going to do a sharper dull test just to tell the numbness, level of numbness in your stomach. Okay, so this is a sharp sensation. This is dull. Okay. Let me know which one you feel. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Excellent. We're going to do a pressure point test here. So this is 1 pressure point. This is 2. Do you feel the difference?
Yes.
Okay, go ahead and say 1 or 2. 1. 1. 2. 2. 2. 2. 1. 1. 1. 2. 1. 2. 2. 1. 1. 2. 2. 1. Excellent. If you don't mind, I'm going to be doing some palpations just to make sure that your organs are appropriately sized, that there's no hardness or enlargement. Okay, looks very healthy to me. I'm going to go ahead and check out your feet, okay? Any issues with your feet? Itching, swelling?
A little bit of itching.
Okay.
I think maybe due to my eczema.
Okay. I'll go ahead and take a look then. Okay, so I'm going to go ahead and remove your socks. And just see what's going on here. I am noticing some patches here, a bit of dryness. I'm going to test your Rapinski response. Okay. Okay. I'm going to be taking this sensory brush and moving it on the right or the left foot. Go ahead and say left or right, depending on which one you feel. Left. Right. Both. Both. Left. Left. Right. Okay. All right. I'm going to just do some measurements to make sure that there's no swelling of the feet or different sizes. 28. 28, that's perfect. It's 15 centimeters. That is 14 plus 14 minus 6, okay. 12. 12. Okay, so the same size. Excuse me, I just want to make sure that your ankles aren't swollen. I'm just going to palpate just to see. Okay, so I don't feel any buildup of fluid, but I am noticing that dryness. I'm going to apply some of that same hyaluronic acid serum that I put on your hair. It's pretty much universal to use throughout the body. It's very, very good. Antimicrobial, and it has collagen.
Okay.
I think your feet will really benefit from it. It's going to be a little cool. Okay, so hopefully that will help. Okay, Mahtab, I'm going to go ahead and order a CT scan for you just to make sure that your vertigo issues aren't due to anything serious.
Okay.
The good news is I didn't really notice anything in particular that stuck out to me. A couple of inconsistencies in your sight and smell tests, and nothing that's too out of the range, but I just want to make sure. Okay, so you're going to go ahead and do that next week, and I'll give you a call to follow up, okay?
Okay.
Other than that, all your other vitals from head to toe were perfectly healthy. All right, so thanks for allowing me to do this exam and coming in today.